Assalamu alaikum. Today's session is about the heart and it is related structure. As we know, the heart is located in the thoracic cavity, in the mediastinum. Okay, the mediastinum between the two lungs. Between the thoracic cavity actually is divided into three compartments. The lateral compartments, two lateral compartments occupied by the lung, and the middle compartment is called mediastinum. In the middle mediastinum, we found the heart at this position. Okay, it is bounded anteriorly by the sternum, and behind the heart we found the descending aorta. We found the esophagus. Here, this is esophagus, and we found the trachea and the main bronchi. Exactly the main bronchi. Okay. So it is inferiorly, it is located or it sits on the central tendon of the diaphragm. This part is the central tendon of the diaphragm. The heart is surrounded by membranes or layers of connective tissue. Those are called pericardium. Pericardium are two, fibrous pericardium and serous pericardium. The fibrous pericardium, here we see this is a tough membrane. This tough membrane is called fibrous pericardium. Is completely surround the heart and fix it to its position. So the main function of the pericardium, the fibrous pericardium, the hold in position or prevent the movement of the heart. Okay, and the great vessels. Okay, then below to the fibrous pericardium, we have the serous pericardium. The serous pericardium is two layer. Actually, like any serous membrane, the serous pericardium consists of visceral pericardium and parietal pericardium. The parietal pericardium is attached internally to the fibrous pericardium here. It's attached internally to the fibrous pericardium. Then we found the pericardial space, and then we found the visceral pericardium just cover the heart from outside. Okay, the heart consists of three layers. Okay, the outer layer is called epicardium, and actually the epicardium is the same serous pericardium. Okay, again we have serous pericardium. The serous pericardium consists of visceral layer and parietal layer. The visceral layer of serous pericardium is the same layer of epicardium. Okay. Then we have the second layer. It is a muscular layer. You can clearly here see the fibers, and it is composed mainly of cardiac muscle. Okay. It's composed mainly of cardiac muscle. And then we have the endocardium. The endocardium is the endothelial lining of the heart from inside. It's the lining of the heart from inside here. Okay. So again, the layers is epicardium, myocardium, and endocardium. The heart consists of four chambers, two ventricles and two atria. Okay, so this is right ventricle, this is left ventricle, this is right atria, and you can't see the left atria from the anterior view. You can find it on the posterior view. The only parts from the left atrium is seen in the anterior view, the left auricle. Okay, the atria found at the top of the heart, the ventricles found at the bottom of the heart. So the heart is conical in shape, as you see here. It is conical in shape. Its apex is directed downward and to the left. Its base is directed upward and to the right. The bottoms chambers are the ventricle, right and left, and they form most of the diaphragmatic surface of the heart. okay, especially the right. Then the atria, the left atrium actually form most of the base of the heart. The right atrium form most of the right border of the heart. So you know the heart has surfaces, okay, it has anterior surface, diaphragmatic surface, the base or posterior surface, okay. Then also we have borders, we have right border, inferior border, and left border, okay. Then we have the great vessels that exit from the heart. This is the pulmonary trunk, exit from the right ventricle, and this is aorta. This is aorta. The aorta exits from the left ventricle. And because of those blood vessels, if you look carefully to the wall, the thickness of the wall of each ventricle, you find different that the left ventricle, the wall, it is a little bit larger or thicker than the right ventricle. See here, it's very clear. The thickness of the wall in the right ventricle is less than the thick of the wall in the left ventricle, and this because the right ventricle, okay, passes the blood toward the, or pump the blood to the pulmonary trunk, and it is only circulate between the lung and the heart. But the left ventricle pump the blood toward the aorta, okay, and aorta circulate the blood to the whole body, okay, or pass the blood to the systemic circulation, okay. So the ventricle are the pumping or the pump part of the heart. Also, the atria are the receiving part of the heart, okay. We have two atria, right atrium and left atrium. Right atrium receive the blood from the systemic circulation through superior and inferior vena cava. So this is superior vena cava, okay, and this is inferior vena cava. The left atrium receive the blood from the lung or from the pulmonary circulation. So you can see clearly here there is 4 pulmonary veins coming from each side, okay, left and right. What else in the outer surface or outer morphology of the heart? There is a groove here. This groove is called interventricular groove, and here between the atria and ventricles there is another groove. This is called coronary sulcus. This is called what? Coronary sulcus. This groove here is called coronary sulcus because it lodges the coronary vessels. Separate the artery, atria and ventricle are interventricular valves. In the right side, it consists of 3 cusps. 3 cusps. This, and this is called tricuspid valve or right atrioventricular valve. Okay. In the left side, we have 2 cusps. This one, and the other one is more deep, and this is called left atrioventricular valve or mitral valve. Between the pulmonary trunk and the right atrium, also we have valve. This valve is called semilunar valve because they are like half of moon, like this, half of moon, like half of moon. So the cusp is like this, okay? So it's called semilunar valve. It's composed of three semilunar cusps. It's composed of three semilunar cusps, anterior, posterior, one anterior and two posterior, okay? Then we have also the same semilunar valve between the aorta and the left ventricle, but it is not shown on this model. Okay, I can find it. No, there is no model for this. So in the heart, again, we have four valves, okay? Between the chambers itself, there is atrioventricular valve, and between the outflows vessels, اللي هم the aorta and pulmonary trunk, we have semilunar valve. Okay. Now coming to the atrioventricular valves, they are composed actually of cusps, but that cusp are connect or attached to a tiny cord. This is called chorda tendineae, and this chorda tendineae attached to this muscle here. It's called papillary muscle. This is called what? Papillary muscle. The papillary muscle actually it is an extension or projection from the myocardium, okay, and give attachment to the chorda tendineae, which also attached to the cusp. Okay, this is for control the movement and prevent the regurgitation of the blood in the opposite direction. The papillary muscle are three groups: anterior group, posterior group, it is deep there, and we have septal group, this septal group. Okay, each papillary muscle had attached to two groups of muscle, attached to two group of chorda tendineae that attach to both neighboring cusps. Okay, this to prevent again the regurgitation of the blood and more control of the one directional or unidirectional outflow of the blood. Okay, so to differentiate between the three groups of papillary muscle, you can look carefully. The septal group is located at the septum, and they are a little bit small than the others. Those are this just elevation here. This is projectional here. It is the septal group. Then the anterior group. This is anterior group. This one and this is one. What makes them more clearly, they are near to the moderator band. You see here, this structure here is moderator band. Okay, this is moderator band. It is attached the anterior papillary muscle to the septal wall, to the septum. Okay, interventricular septum. And the last group is deep group, or the posterior group is located deeply here, this group. Okay, so this is regarding the right side. On the left side, we have only two groups of papillary muscle. We have anterior group. This is anterior group. This is anterior papillary muscles. And on the deep, we have the posterior papillary muscle here. This is posterior papillary muscle. Okay, that is all about the muscles. Then okay. The wall of the heart inside, it is smooth. Normally it is smooth except in certain area. For example, in the atrium, it is smooth all, but in this area inside here, I don't know if it is clear or not. maybe here. Except for the pectinate muscle. The area of the pectinate muscle, it is show roughness, which actually it is the original atrial chamber. Here is not clear. Maybe I found another model contain this. The other rough area on the wall of the ventricle, if you look carefully at the wall of the ventricle from inside, you see it is rough here. And this is called trabeculae carne. It's called trabeculae carne. Okay. Actually, the papillary muscle and the moderator band are modulated trabeculae carne. Okay. So this roughness here is called trabeculae carne. Regarding the blood supply of the heart, as we know, it received the first branch from the ascending aorta. This is ascending aorta here. Just above to the semilunar valve or aortic valve, it gives origin to two arteries, coronary arteries. This is right coronary artery. Here, this is right coronary artery, and this is left coronary artery. The right coronary artery runs in the sulcus, in the atrioventricular or coronary sulcus, okay, and just divide into two branches, the marginal artery and then posterior descending coronary artery. Posterior descending, or other name is posterior interventricular artery. Posterior interventricular artery. The left coronary artery is a short trunk. When it exits the ascending aorta, it just divided into two arteries, as you see here. Divide into two arteries. The anterior descending or anterior interventricular and circumflex here, circumflex coronary artery. The circumflex also run in the coronary sulcus to anastomose posteriorly with the posterior descending artery and supply the posterior surface of the both ventricles. Okay, the anterior interventricular, it gives another branch for the left ventricle, and this is called diagonal artery. There is small branches. For example, this infundibular branch, we have two infundibular from the right and left coronary arteries. Also we have atrial branches, as you see here. Okay, and also we have sinoatrial branches and atrioventricular branch to the conducting system of the heart, and all those small branches you can see it in the lab when you come to the lab. Regarding the venous or veins of the heart, all the vein of the heart drain into what we call this here is called coronary sinus. This coronary sinus, and the coronary sinus is mainly receive three veins. Those are the small cardiac vein. This is a small cardiac vein, and this is middle cardiac vein, and then we have the great cardiac vein. As you see here, the great cardiac vein, this is the great cardiac vein, it is join the coronary sinus from its left tip, okay? The middle and small join it from its right end.